Hey everyone, welcome back to Health Harbour, the channel dedicated to helping you navigate those uncomfortable health issues that no one wants to talk about. And today, we're diving deep into a topic that affects millions: hemorrhoids. Let's face it, hemorrhoids can be a real pain, both literally and figuratively. But the good news is that they're treatable, and understanding them is the first step. In this video, we'll break down the causes of hemorrhoids, the telltale signs and symptoms, and most importantly, the various treatment options available to you. So, let's get started. So, what exactly causes hemorrhoids? Well, picture this. Inside your rectum and anus, there are blood vessels that help things move along smoothly. But when pressure builds up in these vessels, they can become swollen and inflamed, and that's when hemorrhoids form. Now, several factors can contribute to this pressure buildup. One of the most common culprits is straining during bowel movements, often due to chronic constipation or even diarrhea. Think of it like this. When you're constipated, you tend to push harder, right? That excessive straining puts a lot of stress on those delicate blood vessels. Another factor is sitting for long periods, especially on the toilet. I know, sometimes you just get lost scrolling through your phone, but prolonged sitting can restrict blood flow and contribute to hemorrhoid development. Obesity is another risk factor, as excess weight puts added pressure on the pelvic area. And ladies, pregnancy is a common time for hemorrhoids to develop due to hormonal changes and increased pressure from the growing baby. Lastly, a diet low in fiber can also contribute to constipation and straining, increasing your risk. Now that we understand what causes hemorrhoids, let's talk about how to recognize them. What are the telltale signs that you might be dealing with this common condition? First and foremost, pain is a major indicator. This pain might be a dull ache or a sharp, stabbing sensation, particularly during bowel movements. Along with pain, you might experience itching or irritation around the anal area. This itching can be quite persistent and bothersome, making you constantly want to scratch. Another common symptom is swelling around the anus. You might feel a lump or protrusion, which can be tender to the touch. And in some cases, hemorrhoids can bleed, especially during bowel movements. You might notice bright red blood on the toilet paper or in the toilet bowl. Now, it's important to remember that these symptoms can vary in severity. Some people experience mild discomfort, while others have more severe and debilitating symptoms. If you're experiencing any of these signs, it's essential to consult with a healthcare professional for proper diagnosis and treatment. Don't ignore these symptoms or brush them off as something minor. Early intervention is key to managing hemorrhoids effectively and preventing complications. Remember, you don't have to suffer in silence. There are solutions available. Dealing with hemorrhoids can be incredibly uncomfortable. But the good news is that there are a variety of over-the-counter treatments that can provide relief. These readily available options can help soothe symptoms and make life a little easier. One popular choice is hemorrhoid creams or ointments. These topical treatments often contain ingredients like hydrocortisone or witch hazel, which can help reduce inflammation, itching, and pain. Another option is medicated pads, which are pre-moistened with soothing and cleansing agents. These pads can provide a cooling and refreshing sensation, especially after a bowel movement. For those experiencing pain, over-the-counter pain relievers like acetaminophen or ibuprofen can be helpful. These medications can reduce inflammation and alleviate discomfort. It's important to note that while over-the-counter treatments can be effective for mild cases, they might not be suitable for everyone. If you have any underlying health conditions or are taking other medications, it's crucial to consult with your doctor or pharmacist before trying any new over-the-counter remedies. They can help you choose the safest and most effective option for your specific needs. Remember, over-the-counter treatments are intended for short-term relief. If your symptoms persist or worsen despite using these remedies, it's essential to seek professional medical advice. Your doctor can assess your condition and recommend the most appropriate course of treatment. While over-the-counter treatments can be helpful, sometimes the best remedies are found right at home. Simple lifestyle changes and natural approaches can work wonders in relieving hemorrhoid symptoms and promoting healing. One of the easiest and most effective home remedies is a warm bath, often referred to as a sitz bath. Soaking in warm water for 10 to 15 minutes can help relax the muscles around the anus and reduce inflammation. For added relief, you can add Epsom salt to the bath water. Epsom salt contains magnesium, which can help soothe muscles and reduce swelling. Another soothing option is applying a cold compress or ice pack to the affected area. The cold temperature can help numb the area, reduce inflammation, and provide temporary pain relief. Remember to wrap the ice pack in a thin cloth to protect your skin from direct contact with the cold. Dietary changes can also play a significant role in managing hemorrhoids. One of the most important adjustments is increasing your fibre intake. Fibre adds bulk to your stool, making it softer and easier to pass, which reduces straining during bowel movements. Incorporate fibre-rich foods into your diet, such as fruits, vegetables, whole grains, and legumes. Staying hydrated is equally important. Drinking plenty of water throughout the day helps soften stools and prevents constipation, further reducing strain on the blood vessels in the rectal area. Remember, these home remedies can be incredibly effective when incorporated into your daily routine. They can provide natural relief and support your body's healing process. While over-the-counter treatments and home remedies can effectively manage mild hemorrhoids, some cases require medical intervention. If your hemorrhoids are severe, causing significant discomfort, or haven't responded to other treatment methods, your doctor might recommend one of several medical procedures. One common procedure is rubber band ligation. This minimally invasive technique involves placing a small rubber band around the base of the hemorrhoid, cutting off its blood supply and causing it to shrink and fall off within a few days. Another option is sclerotherapy, which involves injecting a chemical solution into the hemorrhoid. This solution causes the hemorrhoid to shrink and scar, reducing its size and alleviating symptoms. For larger hemorrhoids or those that haven't responded to other treatments, surgical removal might be necessary. This procedure, known as hemorrhoidectomy, is typically performed under anesthesia and involves surgically removing the hemorrhoids. While surgery is generally safe and effective, it's important to discuss the potential risks and benefits with your doctor to determine if it's the right option for you. The recovery time for medical procedures varies depending on the specific procedure performed. Your doctor will provide you with detailed post-procedure instructions, including pain management, wound care, and activity restrictions. It's essential to follow these instructions carefully to ensure proper healing and minimize the risk of complications. Remember, seeking medical attention for severe or persistent hemorrhoids is crucial for effective treatment and long-term relief. Dealing with hemorrhoids can be a pain, but remember, you're not alone. Millions of people experience this common condition, and the good news is that there are effective treatments available. From over-the-counter remedies and home remedies to medical procedures, there's a solution for everyone. The key is to understand the causes, recognize the symptoms, and seek appropriate care when needed. Don't hesitate to reach out to your healthcare provider if you have any concerns or questions. They can help you navigate the world of hemorrhoid treatment and find the best approach for your individual needs.